Two federal lawmakers were in the region to tour a local hospital and talk about rural health care. Representatives Morgan Griffith and Diana Harshbarger were in Lee County Community Hospital to hold a roundtable discussion and talk issues in the region. It comes after the passage of Trump's budget bill, which critics said would have a negative impact on health care in our region. News Channel 11's Karen Jenkins spoke with Griffith and Harshbarger, who both say those fears will not come to pass.
Leading up to the passage of the big, beautiful bill, CEO of Ballad Health, Alan Levine, said the passage would be, quote, devastating for rural health. Today, he spoke face-to-face with two lawmakers who voted for that bill. Ballad CEO Alan Levine didn't change his message to lawmakers who voted for the big, beautiful bill. He's spoken publicly about how cuts included in the bill would hurt hospitals in our region.
First of all, everything I said was true. The Senate changed the House version, and what they put in the bill does contain pretty substantial reductions for hospitals that rely a lot on these state-directed payments.
But after meeting with Representatives Morgan Griffith and Diana Harshbarger, who toured Lee County's community hospital, Levine says he feels more comfortable that the two, who now head the House Subcommittee on Health, will fight to keep the area's rural hospitals open.
Because we have a chair and a vice chair from our region, I feel like our issues can be heard. And for the first time that we have advocates who understand the impact of these policies on this region.
But other Virginia lawmakers aren't so sure. Senator Mark Warner posted this video to X just last week.
With the cuts to Medicaid in this bill, close to $1 trillion in total cuts, 17 million Americans losing their health insurance. Lee County Hospital is on the list of hospitals to close.
Look, Senator Warner is doing a talking point that says we're cutting Medicaid. We are not cutting Medicaid. We're cutting the fraud, waste, and abuse out of Medicaid, so that system will be prolonged for the very people it was meant to be for.
Congressman Griffith, who worked alongside Senator Warner to reopen the Lee County Hospital after it closed in 2013, says that closure was due to Obamacare and the expansion of Medicaid. Griffith says he doesn't intend to let the hospital close again.
Sometimes federal legislation does things you don't expect, so I'm out here trying to make sure that we are paying attention and making sure that we keep our rural health care systems healthy and viable.
Congresswoman Diana Harshbarger said, of course, this is not the last bill Congress will pass on health care. In fact, she hinted there's one in the works now. But for now, everyone that was here today says that keeping Lee County Hospital open is a priority. Reporting in Lee County, Virginia, I'm Karen Jenkins, News Channel 11.
Harshbarger also said she's committed to find funding to reopen the Unicoi County Hospital. She says one of the provisions in the bill includes a $50 billion fund for rural hospitals, and she's currently working on the criteria for states to apply for that funding.